A mumps outbreak at the College of Charleston has professors, students, and parents on high alert. The case is raising questions about immunization requirements on South Carolina college campuses. The Count on 2 investigators learned there aren't state mandates for higher education. News 2's Sophia Irzoza speaks to a pediatrician who says it should be regulated.
Measles and mumps outbreaks across the country hitting close to home.
We've had deaths from measles in the past year or two because people didn't get immunized, and that would have been unheard of 10 years ago.
The College of Charleston reporting 5 cases of the mumps this fall. MUSC pediatrician Dr. Sandra Fowler says an outbreak like this is not only unusual but problematic.
And I think we've seen it firsthand. What happens when our vaccination rates decline is people get sick and people can get complications.
Fowler says school campuses can be the perfect breeding ground for disease.
Certainly for diseases that are spread by coughing or respiratory type viruses spread easily in closed populations. And that might be a classroom or a dorm room where those things happen very easily.
State law establishes vaccine requirements for school children in daycare, public, and private schools, but that ends at the higher education level, leaving colleges and universities to create their own immunization policy.
They should have something in place to deal with the different variety of types of immunizations that kids come to school with.
The lack of uniformity a cause for concern, says Fowler, especially when taking into consideration out-of-state students.
When people come to college, they may or may not come from a state that has a high level of requirement for vaccines.
Vaccine exemption rates vary in different states because of legislation, and almost all have seen an increase in the number of exemptions in recent years.
So when you come to college and you have people from all over, then you have no control over that.
Several state schools say they follow recommendations from the American College Health Association. I reached out to the ACHA. In a statement, they say, quote, institutions of higher education have a responsibility to do whatever is possible to support a safe and healthy learning environment, end quote. Dr. Fowler says the risk is there and should be taken seriously.
We do ourselves no service by not getting our vaccines.
South Carolina allows religious exemptions for students up to the 12th grade. Data I obtained shows exemption rates in the Tri-County have more than doubled since the 2014-2015 school year. You can search your county on our website, counton2.com. I've also attached immunization policies for state schools. Reporting in studio, Sophia Irzoza, Count on 2.
If you have something you want us to investigate, just email the investigators at WCBD.com or call that number on your screen, 843-216-4943.